My name is Dr. Babatope Babalobi, and I work for the Bread of Life Development Foundation, a non-government organization working to promote access to safe drinking water, sanitation services, and safe hygiene practices for Nigerians. And we started a new project that is called School Net Total Sanitation Project. And the overall objective of that project is to improve access of school pupils, especially public school pupils, to safe drinking water services, toilet services, and safe hygiene practices for them. And we are doing the project in Ado Odo Ota local government in Ogun State. So what we did basically is to consult with the public authorities. We visited the Ado Odo Ota local government where we spoke to officials of the water supply environmental head department, and we spoke to the head of department who graciously designated two officers who are standing by me to assist us in the program, Mrs. Ajibona and Mrs. Olaitan. So what we also did is to contact the zonal education officer and also the local government education authority that is in charge of public primary and public schools to inform them and to secure approval for this project. And what we did basically in the past 2 weeks is to visit public schools around this metropolis. We have visited about 10 public schools to gather data on the water supply, sanitation, and hygiene practices in the school. We look at the state of the functionality of the toilets. We look at access to drinking water. We look at their water source. We look at the quality of the water the students are drinking. We also look at how they are storing the water. Of course, the OSS is to use this data to write a report that we make recommendations of how to tackle and solve the water challenges that students are facing. In summary, what we found out is that there is no funding for sanitation facilities, for toilet facilities, for hygiene facilities, and for water supply facilities in schools. The existing facilities were constructed by philanthropic organizations, by charity organizations, and by individuals, some by parents. We also found out in many of the schools, a lot of schools don't have any water source, which is a critical challenge for students. A few that have water source is powered by borehole, that is also powered by generators, which also raises the question of how do you get money for the maintenance. Some of the schools that have boreholes also have few water points that students crowd around to drink water. But the challenge of drinking water is not as compound. I mean, the challenge of sanitation is much more critical in more than drinking water. In most of the schools, we found out that there is no improved toilet facilities. Some have water flush toilets, some have poor flush toilets, some have pit latrines. But in terms of maintenance, it's really very poor. There are incidences of open defecation in and around the toilet facilities. Some of the toilets are also full, and there is no money, there is no funds to evacuate the fecal sludge. In a few of the schools, there is no toilet at all, and students practice open defecation around the premises, which raises concern about the safety, because some of this open defecation is in bushy areas around the schools, and there is questions of privacy, there is question of risk from snake bites. On hygiene practices is non-existent. This was done, we learned during COVID-19, but after that hygiene practices is non-existent. There is no sanitary facilities. I mean, there is no hygiene products in most of the schools. So going forward, we are going to write a report, and some of the recommendations that is occurring to us is that we need to look for stakeholders that will partner with government to solve these challenges. And some of the stakeholders we are looking at are private firms that are doing businesses around the Ultra Metropolis. We're also looking at charity organizations, Lions Club, Rotary Club, that are also doing a lot of philanthropic work. We also want to contact the traditional institution to inform them of what is existing in the sample that we have visited. Parents club exists in most of the schools, but we also know that they are inactive, and because of the level of household poverty around the metropolis, we also found out that it may not be possible for parents club to solve this challenge. So in summary, the next step for us is to write a report and submit to the local government for them to deliberate on it. We also want to, as a next step, we want to organize a workshop where we bring all stakeholders together to come and look at the report. And by stakeholders, I mean the public authorities, I mean the parents, I mean the teachers, I mean the zone education office, I mean the Ministry of Education. I also mean the local government and the local education authority. So all stakeholders, the private sector also needs to come on board. So all stakeholders will come to a workshop where we present the findings of this report to them. We present our recommendations on how we can source funds innovatively to address the water supply, sanitation and hygiene challenges in the schools. And lastly, we want to embark on high-level advocacy to ensure that we get funds from innovative sources. And some of the sources we are looking at is, number one, we are looking at the government itself. Government should prioritize the financing of wash infrastructures in primary schools. So we intend to go to the Ogun State government, to the supervising Ministry of Education, to the Ministry of Health, and present this report to them as a sample of what is happening in primary schools, even in Ogun State. So we want to get government to commit itself to appropriating for financing of wash infrastructures in schools. Government at the state level, also government at the local government level, because statutorily the responsibility of providing toilet facilities, water supply for schools, for primary schools, lies under both the state government and most important under local government. We also want to embark on advocacy to the public officers, the representatives at the senatorial level, the House of Rep, the representatives in the House of Assembly, and other public spirited individuals. And not to forget the alumni associations. There are a lot of notable citizens that have come up from these schools. So we want to embark on strong public advocacy to these institutions and also the private sector. There are a lot of companies that are producing products and services that these students need, and they will be willing to support these schools as part of their corporate social responsibility. So that is, in summary, how far we have gone with the School Next Total Sanitation program. And in the next few weeks, we'll be able to report to you and the next steps we are taking to ensure that open defecation becomes history in Nigeria. Presently, 45 million Nigerians are defecating in the open. And this week, there's a big conference that is starting in New York where we are looking at how to solve this problem. So we want to see in our own little way within our facility how to make open defecation history, how to make sure that our students in primary schools have access to clean water, have access to safe water. So it's a narrative that is possible, it's a target that is possible, and we believe with the cooperation of all stakeholders, with the support we have received from the head office of the local government and other stakeholders, it's going to be possible to make sure that every Nigerian school pupil have access to safe drinking water, sanitation services, and practice good hygiene.